good evening or good afternoon.
Hi, Ma. Good afternoon. Waiting.
Yeah, I was trying to see if I could do one-liners, but I
I
couldn't.
know you were so busy morning onwards. Oh my God, you are great.
Thank you, thank you. Okay, so I hope you're all ready for a nice, exciting mild tales. Yes, we finished Rosales. We are doing my tales. We've done
Yes.
Daphne and Mesotherium. And yeah, today we are going to do few more. There are different families of Myodaceae. We are going to do Angophora in that, Kaju Putnam in that, and Eucalyptus in that. Then Eugenia jambus. You know what Eugenia jambus is? So we'll find out. So that is Ezegium. And we've already done Daphne and Mesotherium. Today we are also going to do Mithraceaca one remedy called Cufia. And next time we'll do Granitum, which is really nice. It is pomegranate. And we're also going to do Terminalis Arjuna today. So we're going to do 5-6 remedies today. And hopefully you all will find it nice and interesting. So we did row 4, 2 of them. So you know very well that these species serve as hedge plants, which represent dividing and establishing boundaries. Yeah. And we talked even about the split in the seed, in the sense that that layer is there in both sides. So the themes also we did last time, initial cognitive development. So in Rosacea, the question is how to communicate. And in my tales, it is how do I express myself successfully and be understood? So you can express, but here the focus on successful and to be understood. Though here this stage begins the representation of the mature mind and the ego starts, right? So death of the feminine, the split of the feminine and masculine, and in the process, the formation of the rapacious feminine, we did a lot of it, Black Mother, life and death, all that we did last time. Unpreparedness, congestion, satisfaction of the very instinctual urges. So that is the basis. And we will now do the remedies. So the first remedy we are doing is Angophora lanceolata. Ango is the short form. It is called, in general terms, rose gum or rose apple or red gum. The family is Myrtaceae. Myrtaceae. We saw all the various families which are there. You saw here Myrtaceae. We are doing 3-4 of them. Then Thymacaceae, then Mithraceae, and this is Myrtaceae, and this is Myrtaceae. And here you have Honoracea. So each has only 1 or 2 remedies. And the Combritacea, which has Terminalis Arjuna. I don't think the family is as important to remember. Just remember each of the remedies, okay? So this is an Australian tree closely related to eucalyptus. Eucalyptus also we are going to do, but eucalyptus at least we are familiar with, right? We know the strong smell, people use it for headaches and fever and so on and so forth. So that's also a remedy, but it has many other uses which you will see. So similar by shape to the eucalyptus of the dried fruits. So Angophora is close to eucalyptus. But in contrast to eucalyptus, its limbs are brittle and tend to fall. I just show you the limbs if you can't see them. And they have a gnarled appearance. You know how trees, when they become old, some of them are nice and smooth, some of them are gnarled. You know how you get gnarled means when you're getting old and you have gnarled looks. So they are brittle. So eucalyptus and angophora are related, but they are different. So clinically, it is used often for constipation. Angophora for constipation. We have a swollen, nice man there for you. Figure, swollen abdomen due to flatulence. Then there's nausea, abdominal pain, pressing downwards, and therefore, whenever anything presses downwards, you get diarrhea. You'll definitely have diarrhea, constipation mixed, tenesmus and dry stool. So you'll have after diarrhea, severe constipation. And it is most clinically commonly used for constipation. The abdominal pains are such that only ameliorated by lying on the abdomen and exerting great pressure. So it is so very, very, very important to ask detail. Like this morning, we had a new case from London, a 17-year-old girl. I've never heard so many PMS symptoms and dysmenorrhea symptoms in any girl. And from the time she started at 11, she had all of it. And she had this severe pain. She can't describe it. She said maybe it's stabbing. And she said she has to sit absolutely still. Then she feels little bit relieved. So she may just hold it and sit still. So any movement worsens it. So which is the remedy you can think of? And then she has lot of nausea, and the nausea and the pain go on. They begin with the day before, then the first day, second, third, then it starts becoming less. So it is before the period and on the first day maximally when the flow is very scanty, very little. And then it becomes better. But we wanted to give angophora. We were asking her, do you lie on the abdomen? She said, I can't lie down at all. Even at night, the pains are the worst. Because I try to lie down, but I can't lie down. And she said, best is if I can sleep just sitting. So that is angophora, which is better like that. But our patient didn't get angophora. So you know which is the remedy, the commonest remedy, better by stillness and can't move at all, and nausea and sweating on the face. Anyway, so that we'll tell you later. In the first row, angophora belongs to the first row. You know, we are still dealing with the first row, which is now I don't show you the pictures anymore because you're familiar with the chart. First row was the roseales and the non-roseales, and now we are doing the myetics. So it is connected with the lower part of the body. The lower part of the body that represents more the subconscious and the discharges. And it swells in response to facing anything that is other from itself. So here you have I and the other. That is our row, right? Our row is I and the other. Here you become conscious of, you can move from feminine to masculine, where you start realizing there is something else apart from you. Till the fourth column, which is the delineative, we were dealing with the nutrition line and the mother all the time. Whereas from the end of the fourth row and the beginning of the fifth, we are starting to have the masculine influence, and therefore a lot of fight between feminine and masculine. Feminine tries to be protective, their sensitiveness, something from the heart, whereas this is from not the heart, the mind. And when the other softening part goes away, sometimes you become very harsh. Hmm? So here you start trying to understand that there is an other. And by the martels, you want the other to, what did we just say? Want to communicate and to be understood. So the Rosiers were first more about communication. This is more about understanding and to be understood. Okay. And the ear plays a major role. So you have made middle ear infection with black discharge. So characteristic here would be black. So you have the 3 Ds. She's drawn it nicely for you. Debility, diarrhea, and dysentery with constipation. So diarrhea, constipation goes together. So you left it out the C. Okay. So debility, diarrhea, and dysentery. Even in appearance, it resembles the eucalyptus. It had been proved by F. Cap and produces bearing down. I said, na, abdomen. We saw that nice cartoon picture here. Never forget it. Flatulence with pressing downwards the pain. Tenesmus, dry stools. And better by lying on abdomen. Okay. So you have, of course, lot of medicines lying on abdomen and exerting pressure. You have to add this to your list. You have Colosin, Briania, Maxol. Okay, endless. So debility, diarrhea, dysentery, don't forget. So it has dry, hard evacuations, and therefore whenever there's something hard, you may have blood. And you may also have the other side, diarrhea. So you have always both the sides. But it is known clinically for constipation. You have headache, nausea, flatulent distension, and colicky pain. And this would fit my patient, but it is not only PMS. So pain and tenesmus only better by lying down flat on the face or abdomen. Obstinate constipation, then nausea, sickness, diarrhea with vertigo and debility. So diarrhea, dysentery, we already said, and debility. Don't forget the 3D. Okay, that's all about this little small remedy. So in this particular group, you have remedies we saw earlier. Each one has only some. Only the Myrtaceae have little more, about 10 remedies, 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 remedies. The others only have 2 or 3. And so overall in this whole group, we have very few. And we are going to do 6 today and maybe 3 next time and finish off my. And then we will start with the next. Okay, that row will be done. And we'll start with fables, which is another very, very interesting whole group. So we have seen this is rose apple red gun. It is a tree related to eucalyptus. We have seen clinically it is constipation. And we have seen here that it has swollen abdomen with pains which are pressing downward. Therefore, they may cause even diarrhea. But if you diarrhea, either diarrhea first and then constipation, or the other way around. And tenesmus and dry stools. Okay, pains relieved only by lying on abdomen and the face. And 3 Ds, debility, diarrhea, dysentery, with headache, nausea, colicky pain, and flatulence distension. Right? That is, you have to very, very, very few symptoms. So it's almost like a specific you can think of when you don't get any. We have, these constipation. They say we always have constipation. What do we call obstipation? And say I go and I get pain so much and I have to lie down and lie on my stomach. Then immediately you should think of this memory, Angophora. What is the remedy called? Angophora, lanceolata. Okay, small remedy, but if we can find And then we have to have the theme. Of course, it has to belong to the fifth subclass, which is the fifth subclass, this Rosidea. And we have to have masculine, feminine, means a little bit of the feminine, more of the masculine, something about work and something like the generals which you've done so much and will continue to do, those have to be. So this was Angophora lancea. Second remedy is Kufia viscosisma. It's called Kuf, C-U-P-H, Kufia. Okay. So this is waxweed or the tarweed. These are the common names. The family is Lythraceae. Again, as I told you, the family is not important if you remember the remedy and the column and the row. Another remedy without approving. These remedies are so short because they are not really well proved. They've been using it in some way and then either from the folk, like this has come from folk medicine. Okay. So this is like very useful for cholera infantum. First we saw was for constipation, chronic constipation with pain going downwards and better by lying on the abdomen. Kufia is contains lot of tannins and used as a tincture in folk medicine for cholera infantum. Okay. So the seeds might have a potential to produce an oil with elevated levels of medium and short chain triglyceride. So this is where it may be useful. The popular remedy in some parts of the US for summer diarrhea and dysentery. So it is little bit like the first remedy, which was Angophora lanceolata. Now we have Kufia viscosima, and this is used for summer diarrhea. We also have summer diarrhea and our very common and very popular remedy called bryonia. Yeah. So one of its names is fluxweed. Flux goes, and therefore it is diarrhea and dysentery. It has a clammy, sticky feel. It contains a percentage of tannic acid, and therefore this tannic acid is often used for children which don't rally or are sick after say diarrhea, they don't recover. Then this is very useful for children who do really rally well under its use. So like a tonic kind of. Even after diarrhea, when the children are not well, you can use this a little bit more days to recover. So it is called Kufia viscosima. Clinically, you may use it for all these stomach things: acidity, cholera, diarrhea, dysentery, fever, sleeplessness, tenesmus, vomiting. So more to do with stomach and those complaints. The first one we did, Angophora, was for constipation. And this one is more for summer diarrhea with fever, with sleeplessness, with tenesmus. So problems are in the lower part of the body, yeah? Stomach. Upper part, respiratory, not so much. Last time we saw in some of those remedies where there was gasping, hydrangea, remember? Gasping. Hydrangea, those pretty pink flowers, will become blue when the soil turns acid. So the problem starts after consumption of sour food and milk. Children who vomit undigested food. So vomiting is of curdled milk. So they can't bear sour food and milk. So they always get trouble with that. And the diarrhea also can be due to sour food or milk. So you have summer diarrhea and vomit. So this is folk medicine. What is folk medicine? Just from uses. By accident, you come to know many plants. Even they are plants, they are found. And by chance, it was growing and you took it and became better. And then it was used. Like arnica is called fall herb, right? It grows on mountain on mountains, because that's where you fall the most, and you take it and you heal. And then it was done a big proving in homeopathy, and it's the largest and biggest remedy. In fact, I always tell everybody you should have arnica in your purse always, or in your car, or somewhere, and home always accessible. You never know when you will fall, or you never know when somebody else will fall. And I've used this so often. It is in my car, so I don't carry a purse in the morning when I go for a walk. So it is in the car, and people sometimes have fallen or has been an accident, and I start immediately arnica. I just give it to them and say, okay, fine, just take this dose. Later on, you can come and collect it from me. I stay near. They want. And whoever falls, any of my friends, I remember once she fell and she was full blue, and her arnica, which is she had earlier taken from me, and it was over. And then she desperately sent somebody for one day. It was all full blue. And but the second day after she started the arnica repeatedly, it became so much better. She had just fallen on the road, fully blue. So the problem and the sorry about bringing in those stories, but whatever you remember and it stays with you, by convey, you can use it. You can also tell everybody, or you yourself can keep arnica in your purse all the time and use it. Yeah. In India, luckily people trust. I remember once I went to USA, and in the bathroom I saw one girl bleeding and she had fallen. And then I explained to her I was a homeopath and this and that. But she said, "Oh, I'm fine, I'm much better already. So it's okay." They don't trust you. Of course they won't. But it's your job to try. At least I like to try all this. Okay. Anyway, so that is my experience with arnica. And I cannot say I have much experience with kufia, but once we learn it, especially when you travel to US and you get summer diarrhea, you can use it, okay? And it also helps in recovery. You often give some remedy, like arsenic also helps after diarrhea, even for recovery. Or you give 5-FOS or some other remedy, tuberculinum, to recover. So most of them are problems of the lower part, summer diarrhea and vomiting, we already said, from sour food and milk, and they vomit out curdled milk. It looks as if the food has passed through the child in a restless manner without stopping. I mean, the child has taken food, it has not been digested, nothing just passed through, and it comes out little bit curdled, like the milk is taken, comes out curdled. Or it may be persistent constipation. So you will say, what are the difference between Angophora and Kufia? So here you have the child who's lying down, not lying on his stomach, but he's still pressing his stomach. So these are difficult differentiations which you have to do. Child is very restless and fretful during diarrhea, has tenesmus, pains, and a high fever. In the Angophora, we didn't see so much fever, though there was pain, there was tenesmus, but there was to lie on the abdomen. So the child also, by trial and error, it finds out which is the best way where the pain is a little bit less. Can't fall asleep. It feels scattered. So another important word here is scattered in every aspect. This is the kufia. So that's all. That's only the second remedy. Can any of you repeat for me the first and the second? Dr. Vibha, first remedy was Angophora. What did we learn there? Kriti, you will make it mic available to Dr. Vibha. Yeah? Can you do it? I'm just doing this because they are small remedies and can easily be used, and it would be nice. So you had from Rama, debility, diarrhea, dysentery, which is very good. You had the Bearing down pains, very good. And you have the pains which is better by lying on the abdomen or the face. Then you had the second remedy which is called Kufia. Yes, tell us about Kufia. This is in the chat box. So, yeah, correct. Very good. That was Angophora. Now, in the second one, you have summer diarrhea. It's often used, they say in USA, but we can all use it. We have more summer. And you can have from sour food and from milk. And the thing comes out as if it's never been digested, comes out as curdled milk. Child is very restless and fretful and has pains and a high fever. Feels very scattered. Okay, so we've done 2 remedies. Now we'll do another remedy. Kaju Putnam. So this is Kaju Putnam. It is white tea tree oil. You know, tea tree oil has become very famous these days. Everybody talks about applying on the face or something, and you use tea tree oil. This is white tea tree oil. Family is Mytales. As we all know, we are doing Mytales. Natural order is Myrtaceae. The other one was a little different. And Kaju Putnam is derived from leaves of the Melas leucadedron. And that's again not important to remember as long as we remember Kaju Putnam and catch. So again, it's come from the old school or like common use of folklore, the many remedies. And therefore they are so, you've heard of them, like we'll be doing eucalyptus also. So use it as a local application in rheumatism and dysmenorrhea. But its homeopathic proving reveals a lot of reliable symptoms which lead to application in headaches. We saw prunus, you remember the prunus headache? It is like, prunus is like thorn, no? And it's a headache with nothing ever relieves. That is prunus, yeah? And lot of, as if it's a thorn. Its love is also like thorn. It's almost always from disappointment in love, prunus. All the rosanes are like that. So this leads to its application in headaches. But normally in headaches, you'll have something better. Some people say we tie it up tight. Some people say somebody massages it. Somebody says I rub the back. Or somebody says I just go to sleep in the dark, like Brian. I don't like noise, light, anything. And you would immediately give Brian. But there is something which is better. Whereas we saw prunus, which belongs to the Rosales family, that it is not better by anything. So here you have headache, which and dysmenorrhea and rheumatism, and headaches, hiccups, and stricture of the esophagus. So here you have from the leaves of the Melaleuca, leucadendra is often called weeping paper bark or white paper bark or long leaf paper bark. These are the common names. Of Kaju Putnam, the main sensation is congestion. The whole group, congestion is the main thing which we saw, and therefore today also I repeated it, that it is mainly congestion. And congestion means swelling, and swelling we saw in the first one, in Angophora, we saw the swollen abdomen. And here he says, I was a good deal larger all over. I felt that I was larger because I had congestion. And so there's biggerness, swelling. I feel larger and I could not get myself together. Small and trim, large and fat. So a sensation of enlargement, swelling and widening of the organs. You feel like that and you feel scattered. So scattered is the sensation of this family. We saw that in the previous kufia, where very few symptoms, but feels scattered. We saw it had summer diarrhea with milk and sour food, curdled milk, but main thing was that feels scattered. The pain was. So this is Kaju Putnam. I'm a grow deal larger, enlargement, swelling, widening of even the organs in the body and feel scattered. The head is enlarged as though she can't collect herself. Very peculiar symptom is could not find her clothes for a while. Mean the clothes were nearby, they couldn't find, so it's lost. Lot of things about this also, like the first row, especially in the first subclass. We have the first subclass in which we Nakmoschata, which always said lost in well-known streets. So here also clothes, she put them, but she's forgotten and she can't find. And she got up as if she had a night of debauchery. She had not done anything. She just got up feeling like that, as if all night she's been out drinking, partying with friends, and got up as if you had a night of debauchery with a heavy head and all that. And she feels you're not in your senses, you're lost, you can't find your clothes, you feel as if you're going to fall down. Feels now another part of the body also feels scattered. Lungs are about to be scattered, and she has to hold them, the lungs, she has to hold in order to prevent them from scattering. But she has to hold them very lightly. She can't tolerate any pressure either on the lungs or on her abdomen. So you saw in the previous remedy that nice swollen big abdomen in Kufia, and in Kaju Putnam, you're seeing as if the lungs are going, and she needs to hold them, but she can't bear touch, or she can't bear, pressure. Touch she can bear. So it is as if lost herself, gets up as if there's a night of debauchery, she has fall down, lungs are going to be scattered, she has to hold. Feeling of restlessness all through accompanying the congestion. Congestion is also felt especially in the nape of the neck, and an unpleasant sensation of heat emulated by cold. So the whole, when you have scattered, means the nervous system is involved with restlessness, and that is also congested. So you have the hysterical nervous system. Another peculiar characteristic is profuse flow of saliva with constant inclination to spit and hawk or swallow all the time. And a lot of phlegm with night aggravation. So this is more up, phlegm, all the time wants to swallow or to throw out, hysterical, nervous, restless, congested, and you have as if the sensation we saw in the previous slide, as if the lungs are to be scattered and to hold them to prevent them from scattering, but can't bear pressure. Feels as if has been out and has drunk a lot, so much she can't collect herself and feels so giddy, can't do anything, can't find her clothes, and finds that she about all the organs are scattered. So hysterical nervous system. There are problems not only in the phlegm, but other mucous membranes also. Flatulence that bloats, we saw that in Angophora also. Belching from the slightest excitement. So here it is more getting more nervous. Emotions are being choked, and therefore there is belching from the slightest excitement. Hysterical breathing problems appear and disappear. And a feeling, a sensation that one is choking all the time. The trachea closes spasmodically. So you're choking. We saw that choking even in hydrangea. But so it is, there will be a lot of common, and therefore I wanted to do the one-liners, but I have only managed to do 14 or so. Anyways, so each one has some characteristic. Today, I'm trying to repeat more so that it stays with you. The angophora had that abdomen and the pulling down pain and better lying on the face or the abdomen. And it had constipation and diarrhea. Then you have the second one, which was kufia, which also better by pressure, but crying, more, getting more hysterical. Kaju Puttam has sensation as if lost, as if drunk, as if had a night of debauchery, can't find clothes, lost, as if lungs are going to be scattered in order to hold them. And this feeling of choking. So, choking and flatulence and belching are all due to emotions being choked. So, you can see that there's a lot of emotional and nervous system problems here because the feminine is really becoming less and less, and the masculine taking over, and they are fighting. So the esophagus closes, making it difficult to swallow and almost paralyzed, can't even take food. The sensation is the tongue is swollen. See this nice big fat tongue? You won't forget, you won't forget. Thank you, Fatima, for the nice pictures you give. Tongue is swollen and filling the mouth until one is afraid he will choke. So in Kaju Putnam, the most important thing we have seen is hysterical, mind involved, choking, swollen, scattered, where lungs are going to be scattered. So these are the feelings. A stiff, dry feeling in the jaw. We have to only pray, please God, send us these kind of patients. Yes? A stiff, dry feeling in the jaws with neuralgic pains in the malar bones. Yes? Neuralgia. So here you have the nerves getting more and more involved, as you've seen. All the fight between the male and female, a male, masculine, feminine fight, and see what happens to the patient. Okay. So mouth feels choked, he feels swollen, he feels paralyzed, he can't swallow, and the tongue is so big that he can't even eat. So here, the feminine aspect dries up. So if feminine aspect dries up, the soft is getting dried. We saw in the other remedies also, na, soft and hard, soft and hard. There's a confusion between whether the organ is soft or soft organ also feels hard. So when feminine dries up, masculine comes in, you have a lot of rigidity and paralysis. And the feminine still causes swallowing or too much phlegm, as we saw in Kaju Putnam, right? We saw the tongue, we saw the phlegm, too much phlegm, and feel one is choking all the time. Is it the emotions which are being choked, right? So, be at the beginning of the column, it is still right on top. There is still a struggle between the masculine and feminine, which created the split. He felt sad and didn't want to be spoken to. Does not want to speak to people, withdraws. Each person, very differently. Somebody feels sad but want to cry and be hugged and better by consolation like pulsatilla. And somebody doesn't want to be spoken to or touched or anything. Like we know our well-known remedy would be Brahmia, and here you have Kaju. Did not want to speak to men because men are threatening, they are rigid, they don't give you any consolation, they don't give you any emotion, they don't let you have any feeling. If you cry, they will make fun of you. But felt free with women who are more accepting. More accepting. And with women felt free, could talk and laugh, and could overcome the sadness. Rubrics, really rubrics are there. If you all have your repertoire, you can look it up. Approach of person's aversion to, and you will find CAJ. And you'll feel very happy that you have learned a remedy which is there in the rubric. Because how are we? The most common question I'm asked is one, how are we to find these remedies? So, second is, where do we buy them? So yes, I've given some leads. We are also even till today, we have not been able to find Rosa B in any of the Indian cities yet. And I really wanted to give Rosa B to one patient. Anyway, approach of person's aversion. Clairvoyance, reading one's mind. We've seen confusion also can't find clothes. But company aversion to, walks alone, wants to be alone. Conversation also aversion. Debauchery ailments from, whether real or imagined. So dreams of cursing, we've seen that from feminine to masculine, you can become from soft to hard, from good natured to even bristly and cursing. And here you have a peculiar dream disposed to act like a rowdy, like a wild element. Okay? And dreams are of cursing. So, very different from that naive, pleasant person we saw. Okay? Ideas deficiency of. Since it's confused, sometimes we can look up these rubrics. In confused, we may not get it. Ideas deficiency of, ideas which are slow, indolence, aversion to work, sadness, mental depression, speech slow. In a person who had normal speech, now speech slow, you can make out there is a change. Spoken to, aversion to being, conversation, aversion to being, aversion to being, and likes to be alone. Wants to be left, and then walks. And the walk is very peculiar. Walk slow and dignified. Walking slow and dignified, and aversion to mental work. Because there is confusion in the brain, like your first family, Nakmoshata family. Lot of confusion and loss. So that row, there will be common characteristics. Of the column, there will be common characteristics. And wherever you cross, you can give the remedy. So today we will learn these remedies, but we will go away remembering these remedies. Okay. I want you all also to repeat Angofora for me, Kufia for me, and this is Kajuputnam. Kajuputnam, there is lot of scattered feeling, which is more than even in the Kufia, and it wants to be left alone. It has the fight between the masculine and feminine has left it very brittle. It wants to behave rudely and like a rowdy, and it has dreams as if behaving rowdily. And then it has dreams of conversation, doesn't want, people doesn't want, wanting to be alone. But still there is this dignity. So he walks slow and dignified. So homeopathic proving showed a characteristic sense of enlargement, which we saw in all the three. All the three remedies we've done so far had enlargement, so I put it in red. A feeling of being too large all over, as if the head as large as half a bushel. Bushel means a bush, a big bush, and the head is as large as half of it. Okay, scattered. We know one remedy which has scattered feeling, bacteria, right? We find it in typhoid. And we say always, I still remember in college being taught, scattered, trying to pick a bedclothes, trying to gather things. So bacteria. And could not get his clothes for a time, though they were quite near. This is Kaju Putnam. This we didn't hear before. So you had the lungs as if you were scattered. You had clothes as if you can't find. You had a night of debauchery where you got up as if your head was heavy. You were about to fall. You can't find your clothes. As if your head is as large as half push. So when you've had too much to drink, you get up in the morning with this big headache. Na? All these people have lots of therapies for drinking in the morning after you've had a night of too much to drink alcohol. So feeling as if though you can't put yourself together. Reminds you of Humpty Dumpty, no? Can't put yourself together. Once you're scattered, you have also the other family where Melilotus and the pea family, where you're scattered and no longer can come together again. So in that family, when we do, it'll all be about families are scattered and then the child or whoever feels never quite well after that. And here he didn't want to speak to anyone, felt sad and downhearted as if could cry, wants to walk in a slow, dignified manner and alone. Can't think of anything. Ideas come slow because the whole system is slowed down and is scattered. Can't bear to do any work or study. So all of us, we are all studying, see? So all of us don't need Kaju Putnam, yeah? Feel stupefied and completely intoxicated in the afternoon. Normally you drink at night, morning you're bad, but afternoon start regaining. So here he still carries on. Morning he gets up, he can't find anything, head is too big, feels as if had a night of debauchery, and his lungs as if they're going to be scattered. And he can't do any work, can't recollect anything, can't find the clothes. And that continues in the afternoon when he feels still intoxicated. So finally, the split causes half-sided paralysis. You saw in the previous lecture where you had one part, right? You saw in that remedy which had yellow sand in the urine, hydrangea, and one part of the body missing. Here it has half-sided paralysis and one-sided neuralgic pain. Half. So lot of parts. And the parts mean the split is creating the parts. You don't feel whole yet. You're still feminine, still masculine. This is feminine, masculine. And saying, see, I'm still there. Masculine saying, no, you have to go. You already had your 4 subclasses. Now give this to me. Yeah. So here this craving for sweets, which, comfort food, and then which leads to nausea. So you can have sweet aggravation. So the following symptom express the struggle. In this dream, he wanted to swear and behave in a crude manner. Normally, a nice, polite, soft, well-spoken, dignified person wants to swear, behave in a crude, rowdy manner, and be bad to everyone after his night of debauchery in his mind or other. So there were also crude sexual dreams and a feeling of strong need to be held, but with the erection. The clinical peculiarities, testicular dystrophy, both the column and the lines say that, because you have masculine and feminine split. The urine smells like a hamster. You have a hamster here. Has anybody ever held a hamster? They look cute. They're horrible to hold. I've gone to some old friend's house in Germany, and his daughter liked hamsters. I think she also liked a hamster because once her door was opened by mistake, and the whole sack of grain which she kept for the hamster feed had fallen. It was like that all the days that we stayed there. She never picked it up, and the smell in that room was like very bad. Hamster's urine. Unfortunately, I never had any. I didn't know the remedy, nor I had any chance to give it. So it smelled like cat's or hamster's urine, quite strong. This is the last struggle between the old feminine quality. Feminine is spread. Everybody come in, no problem, without boundaries. Masculine, this is me, this is my father, this is my work, this is my company, and this belongs to me, that belongs to you. So a quality that belongs to the previous column, and this young masculine column, quality of the fifth column that aspires to rise. But it's a limiting quality, rigid and formative. Yeah. So rigid, formative is masculine, soft, expansive, taking everybody in, but also becoming dark and black, draconian, the Kali, the goddess Kali we did last time. So that also is becoming, because it has to hold on, and way to hold on and hold on, you become a little less soft. So the struggle creates the spasm. Whenever there's a struggle, there's a pull, there's a spasm. So we are doing Kaju Putnam. Catch, catch, catch to friends. So in the mouth, there is stricture, spasmodic stricture of the esophagus. So we have seen that there's spasm, there's congestion, there are parts which are missing as if you have lost your mind, as if you're debauched, as if you want to behave rowdily, and you have seen choking with the emotions choke. So here also you have the spasmodic stricture and the sensation of choke. The constricted sensation on swallowing solid food, much water, and like we saw, phlegm also. Wants to spit a good deal, profuse flow of saliva, constant inclination to spit or cup large quantities of tough white mucus, can feel drawn through the sinuses also it comes. What we call the post-nasal drip. And from there, and it spits and spits and spits, and saliva dribbles even when you are sleeping. So lot of choking, lot of stricture, lot of enlargement, lot of emotional choking, can't swallow solid food, water in the mouth, parts are scattered, feeling lungs are going to be scattered and to hold them, and don't want to be conversed with, don't want anybody to talk to you, don't want any consolation, want to walk soft, slowly and in a dignified manner. And sometimes we just want to give in and become completely rowdy and badly behaved. So the mouth, cool and not unpleasant sensation also. Taste in the mouth to lie. Salty taste after intense thirst. Drink, and instead of feeling cleansed, you feel salty taste. Acrid taste. We saw sour taste also in the other remedy, the previous remedy. Kufia, where sour and milk. Here you have salty taste, acrid taste in the pharynx and esophagus. Speech is thick and slow, to do with the first row, yeah, to do with debauchery, to do with your head confused, and as if you've been drinking a lot, and which carries on till the after. Erections in the male with great desire for an embrace. Erections at night and in the morning without the least sexual desire. So you have always the opposite. Or the penis shriveled and shrunk, and loss of sexual desire, like in C. Modalities, better in open air, we already know, walk alone and dignified, without anybody, not talking to you. Better from pressure, we saw that in Kufia and we saw it in Angophora. So it is going to continue to the third remedy. Better lying down, we saw this also in Angophora. Worse at night, we saw that also. Worse bending forward. Sorry, this is a mistake and I don't know what it is. Worse rain. Okay, must be right sided. I don't know, I'm sorry. Worse itching and scratching. But here, even you see the skin, it is better by scratching. Okay, peculiar. So you have the case where she says that a woman in her 50s who complained of extreme restlessness. She says, I have restless legs all over the body, as if they are there all over the body. So again, scattering. It was diagnosed as a state of heightened neural sensitivity. So it is there in generals, in the repertory, neurological complaints. She was given dopamine, like Parkinson's patients are given dopamine, and she was only able to sleep with that. She had been suffering from jerking movements all her life, again scattered, right? But her condition worsened much during pregnancy. She needs to walk. We saw in the symptoms also, walk dignified. So this is a congestion that does not go away. Dissipate means go away. And causes restlessness. So it's not causes, it is causes restlessness. So when you have congestion, you want it to go away, you're restless, you want to walk, but you want to walk alone in a dignified manner. She describes herself as active and someone who enjoys sports, but she's too exhausted most of the time because she's had this night of debauchery. She gets up confused, she can't find her clothes, even though they are quite nearby, and she feels the head is enlarged. It's like half a bushel, and she feels that her lungs will scatter, and she has to hold them, and she can't bear touch, and she has to walk and walk alone because that will help to get rid of the restlessness. But now she's too weak, too debauched to do all. She took sleeping pills because she emphasizes, I couldn't afford not to work. So she had the responsibility. So you see the masculine coming up. In the feminine, she could have said, okay, I'll sleep and I'll do the work later. But here she says, I couldn't afford not to work because you have the strict father who is a rigid masculine. So you have the strict father or the one strict parent. It can be either the male or the female. We saw in Rama's case earlier how it was the mother who was strict. So she couldn't afford not to work. She has slight digestive problem. She that all her life she had problem with her father. So the rigid masculine quality in this case. So you have things, she has to take sleeping pills. She couldn't afford not to work. She had a father who was always strict. She had digestive problem. And she answers shortly, very minimalistically. I like the zip. Mouth is zipped. As though being questioned bothers her. She's averse to being spoken to. So you saw that in the symptoms also. Wants to walk, restless, alone, doesn't want to be questioned, doesn't want to converse, doesn't want to be taught. So this was a real case. So here somebody spoke to her in the clinic, which she doesn't like to be spoken to. How she expects to come to a doctor's clinic and not be spoken to, that we don't know. And she just got up and left, which is not typical behavior of the society in which we live. So I had this one patient once, and I was treating him for alcoholism. And then they had been better, and then they had given up. And I didn't realize it was the wife who was, making give up. So that day they came back after many months. He and wife both came back. And I had heard that they were, going to Pune. He had already gone to Pune and started a small restaurant. And the wife was also, she was staying here, and the school was here, and the children were here. And I just, by the way, told her, that if he's going to Pune, then you also go with the children. She was so offended that I tried to advise her. I didn't know that. She suddenly got up. I thought she remembered something. She got up and went away, went out of the clinic and out onto the road. And then later I realized and was told that she had gone because she was angry. I was giving advice to her. Maybe we should have given her Kaju Putnam. Yeah. Maybe I'll still try because rest of the family still comes to me. She's really very dominating and very, wants everything her way. So the symptoms for case 1 was self-control, loss of restlessness, nervous, and she was a woman. Bed going to aggravates and convulsion spasm hysteric. So when the remedy was given to her, the first follow-up, she said better. Then later she said she did a whole bicycle tour of Santiago de Compostela. This is a place in Spain, which is supposed to be the most elegant place of the whole thing. It's also heritage protected, and it's beautiful. It's very pretty, though, out of whole Spain. And so she did and to see it is very good. So she did a whole bicycle tour of that. She's more relaxed. She does yoga, which now helps her, but previously it's a very slow thing, so it may not help everyone. It doesn't help me also too much. So, some people need a little more active kind of a solution. And now she had half, she was on dopamine, you remember, for her sleep. She was taking half of the medicine. And now she had a dream that she was running after neighbors because they did not greet her. Earlier, she didn't want anybody to talk to her. Now, she said, I wanted contact, but did not get it. And previously, she wanted just to be left alone. So, your whole psyche somehow changed. Later, she had pneumonia. Again, the same remedy, Kaju Putnam. You saw that case of Dr. The other doctor who presented us a case. And she said the same remedy prunus helped her in many complaints. So here her pneumonia became better with Kaju Putnam. She suffered from flatulence, which bloated her, and complained that it was a major disturbance in her work. But she had halved her dopamine intake because she felt that her muscles were more relaxed. In this manner, she gradually reduced both her dopamine and her sleep medication and everything. Condition is improving. She's no longer bothered by restlessness, says Anne. So there was another case. A woman who had the sensation tongue is swollen. Remember that nice drawing we saw, that cartoon picture of the tongue so swollen? If you can get a patient like that, you'll immediately give Kaju Putnam, right? So tongue is swollen to the point of suffocation and a feeling that the teeth will go and protrude from her mouth. So enlargement, feeling, congestion. They using congestion in a very broad sense. Everything, swollen, whether it's abdomen and the flatulence, or that, or the scattered feeling also in a very broad sense. And here also feeling that the teeth will grow and protrude. Again, that is a form of congestion. And tongue swollen is also congestion. So a congestion, which is a like all-encompassing symptom for this group. So the background was there was suppressed anger and indignation with jealousy because there were gossiping neighbors. But she had to swallow and not say a word. So it was all suppressed her anger. She presented as angry, sad, unforgiving, and resentful. So the bad part of the group, yeah? The feminine going down and the masculine coming. She's also hard, does not show emotions, and a loner. We've seen as we go little bit down, the masculine become more stronger. Kaju Putnam helped enormously. It restored happiness and lightness, which is feminine. So also there was a George Vitulka's case. He gave the remedy to a hysterical, vulgar woman who swore, very masculine, right? The hysterical part is feminine, but vulgar, and swore at everybody and boasted and domineering. She included a husband also in the shouting and the screaming. Wealthy and domineering woman who came because she felt her tongue was swollen and she was suffering. So it's very characteristic. We'll also all pray to get a case with a swollen tongue and suffocating, or not suffocating, but at least swollen tongue and some of these characteristics. And we'll also give Kaju Putnam. First, we have to get the Kaju Putnam. Yes. So we've done now 3 remedies, right? We did Angophora with the swollen abdomen and the pain better by lying on the abdomen. And we did Kufia, which all started the scattered feeling. And then you had Kaju Putnam, which had lots and lots of symptoms. And you will remember all of them, you remember all the rubrics. Modality, better in open air, better pressure, better lying, worse at night, worse bending, worse itching and scratching, and walking dignified and slowly. And what else? I did not want to speak to anybody. I wanted to cry. I wanted to walk slowly. And I just wanted to get over my restlessness and my congestion, which wouldn't go. So if I walked, it would go away. My head doesn't work. I get up as if I've drunk a lot. And that whole thing goes on till the afternoon. My clothes I can't find, though they are nearby. I can't do any work or study and feel intoxicated even in the afternoon. Being too large, can't put myself together like Humpty Dumpty or Baptisia. And they want to be left alone. All these are rubrics which you can find, and we find ideas are not there, indolence, doesn't want to work, approach of persons, aversion to clairvoyance, company aversion to debauchery, and then become very masculine, cursing and want to behave like a rowdy. Okay? Yeah. So we'll remember Kaju Putnam now. We had this cases also we saw, right? So the cases also were nice. She has restless legs all over the body, she says. She has heightened neural sensitivity. She took a lot of medicines for falling asleep. Jerking movements. Needs to walk because to get over the depression. Restlessness and the congestion. And she was active, who enjoyed sports, but now cannot do. And I cannot afford not to work. And I had a father who was very rigid. So she talks very little. The zip, don't forget, averse to being spoken to. And somebody spoke to her in the clinic. She just got up and left. Fortunately, she must have come back because she got her remedy. The symptoms were self-control, loss of restless, nervous, bed going to aggravate, and spasms hysteric. So she went on a bicycle tour. So she could walk, that means faster, no? More relaxed, doing yoga, after medication, and dreams of the neighbors who didn't greet her and she wants to be greeted now, which was not in the past. Right? Tongue swollen, that we know, even we told fast. Gave it for the tongue swollen and the choking. And this woman was angry, sad, unforgiving, and resentful, lost of masculine, lot of the masculine qualities, and suppressed anger, indignation, which she had to swallow, though the neighbors spoke badly about her, and she's alone. So they brought happiness and lightness, so brought back the feminine element. Same thing, George Vitulka's case, wealthy, domineering woman, felt her mouth was swollen, tongue was swollen, she was very hysterical, vulgar, put everybody down, and she was also helped by Kaju. So we come to the fourth remedy, eucalyptus. Eucalyptus, we know a little bit, all of us have the eucalyptus oil in our houses. Whenever you have fever or headache, you put that, and the strong smell is there. And we saw that one remedy, Angophora, is very close to eucalyptus. So it is commonly used to treat various health conditions, marked effect on intestinal disorders, catarrhal conditions, and malaria. We saw Kufia has summer diarrhea. This has malaria. It can be used to treat influenza, high fever, and urinary disorders, including excessive urination. We must remember, you must always try to compare. We had hydrangea, right, with the urination, all the pylitis and everything, all those symptoms, with the yellow sand in urine or white amorphous sand in the urine. And here you have urinary disorders, excessive urination, with urea. Eucalyptus have been largely used for bronchitis and bronchitis. So it is called blue gum eucalyptus. Belongs to the same family like Kaju Putnam, Myrtaceae. We are doing Myrtaceae group. The tree originally from Australia, transported worldwide. It's very fast growing. It's very peculiar. It requires lots of water, and therefore, which it gets by sending down deep roots. Okay. And in Israel, it was planted to dry up swarms because it takes so much water. The swarms dry up. If you plant the eucalyptus tree, it's very good. Due to its fast growth, it can grow on any object. So if you lean against a eucalyptus tree for long enough, it will grow around you also. Yeah. Anything, that object lean, you put something there and you've gone away forgetting all about it. Next time you come, it won't be, your ladder won't be there. The eucalyptus tree has grown around it. The tree bark peels continuously. The eucalyptus oil is similar to the disinfecting quality of the tea tree oil. I was telling you about that white tea oil. This is tea tree. It is used for opening up blocked airways. We use it, na, eucalyptus. You put it in your steam also. And for nasally congested children, breathing freely and suffocation. So if you're suffocated, put eucalyptus, give them a steam, and you'll find that it opens up. Yes. It's a powerful antiseptic and disinfectant. It allows the mucous membrane producing profuse catarrhal discharges, acrid and foul, with aching, stiffness, and weariness. As from whenever you get a cold, you'll feel a little feverish, aching all over, tired and weary. And so you saw that even in the earlier remedies. They can't work. Kaju Putnam says, I can't work in the morning, feel very weird. It's a preventive for influenza. Malaria, influenza, sticking, jerking pains at night. Exhausted with toxemia and hemorrhage. Rheumatism. We saw the earlier one, powder, applied for rheumatism in a clinical use. The first stage displays the expansion stage. Yeah, expansion is still feminine. Expansion involving everybody. Joviality, lightness, excitement, wants to activate the mind. Buoyancy, increased strength. It's right in the first stages. The next stage, this becomes too much. And the feeling of confusion, although hasn't slept enough, feeling too lazy to move, dullness and weakness of thoughts. For days, he was there like a drunkard. This is like Kaju Putnam. Yeah, so you'll have a lot of commonalities and you have to find the peculiar things that will differentiate. Dizziness and headache, both in the forehead. So a lot of cold symptoms, a lot of fever symptoms, influenza symptoms, used as a preventive for influenza, for malaria. When you have that, you'll have body ache, you'll have confused feeling. So allergies and nasal congestion. I'm congested, I can't stand it anymore. So they gave eucalyptus in the steam. The throat is swollen, ears are inflamed. We're not talking so much of choking like in the previous remedies. Influenza with much salivation. Again, same like Kaju Putnam, lot of saliva. Offensive discharges, cancer and gangrene of the mucous membrane. So this is a syphilitic quality. Yeah. So you have nasal block, nasal congestion, give a steam, eucalyptus opens up, the suffocation opens up, and you have breathing, you can breathe freely, and your allergy is also better. The eyelids are heavy, slightly dull. So influenza, all the symptoms are there, including the cold and the running and the allergies and the body ache. Yeah. And the dullness and inability to work and the weak. According to its earlier location, the mind cannot be activated. We saw the first part, no? Joyous, buoyancy, everything, and then goes dull, down. And instead some emotional outbursts come. You cannot activate your mind, and therefore you feel angry with yourself, and you have a burst of emotion, anger or sadness or crying or something. So mind had lack of confidence in the ability to perform. When you no longer can use it when you want it, then you always feel as if, will I be able to do it or won't I be? They don't have any more ability to listen to the inner feminine guiding voice. The feminine always guides with the heart. And then you lose that and you don't know, the head doesn't rule and doesn't work, and you don't know what to do because the mind is not yet strong. Anxiety over their lack of confidence, weak inner guidance, and weak ability to performance. So they are very confused. They have the masculine, which has still not taken over. They have the feminine, which is going backwards and don't have their guiding voice. And then you have no ability to perform and you have a lack of confidence. So mental exhilaration with feeling of buoyancy and increased strength. That is one part. Desire for exercise to move about is the first. Intoxication followed by mental depression. So all this buoyancy then comes down and you have depression and exhaustion and dull and drowsy. So you have first the buoyancy, joyousness, expansion, wanting to include everybody. And then you go down and you have depression, exhaustion, dull, drowsy. Lack of confidence, don't know what to do, mental confusion, can't do mental activity, and no inner guidance, and then no ability to perform and succeed. So rheumatico-hydrogenoid constitution. We saw, in Israel, they put it in swarm. Hydrogenoid, can absorb water, lot of water, drinks a lot of water. And rheumatic, we saw also the tree. Whenever there's a tree, there'll be rheumatic. Marked effects on catarrhal processes we saw. Lot of nose block and all these things, and you have lot of phlegm and lot of saliva. Intestinal disturbances, malaria, fever, influenza. Old malaria it can be. Profuse catarrhal discharges, acrid and foul. Eucalyptus, very, very strong smelling. So from there to acrid and foul is one step. Bronchitis infection with profuse purulent expectoration, with loss of weight and night sweat. So whenever you have any infection, any influenza, bronchitis, going on for a long time, a lot of discharge of saliva, then you have night sweats, you have loss of weight. Bronchitis in the aged, treated bronchitis, bronchoria in rachitic children. So children who lose weight, don't have enough energy, lose all the vitamins and become rachitic. So bronchial asthma with great dyspnea and the palpitation. Never forget, you have this asthma lung, you have the heart, you will have the headache. All these three always go together. Mental exhilaration or depression, migraine. Thin watery coryza with tough sensation. Or no, does not stop running at all. You give that eucalyptus, then you open up, the running may even stop. So you have spread or you have obstruction. So you have flatulence and bloated abdomen, the digestion is slow, and the pains come only after few hours because the digestion is slow. You eat now, but the pains come much later. So all abdominal problems also, dysentery and diarrhea. We saw the 3Ds, dysentery, diarrhea, and debile. Dr. Rama very nicely put on the chat. Or you have severe chronic constipation, seems all the remedies have this, right? All the 4 remedies you've done so. Urine is difficult to pass, can reach the stage of obstructing tumors in the urinary or acute nephritis. Even high masculine libido, we saw in Kajuputnam, sexual wants and embrace with an erection, or sometimes no erection. Congestion in the chest, feeling of pressure like a hot pressing belt. We saw in that prunus, remember? We had the pain which went from the left nipple to the scapula. Hot pressing belt and a desire to move, buttocks. So all these remedies are described in our Materia Medica. And if we learn it just randomly, each remedy, not remember. But if we learn it through this kind of a study, so many commonalities are there. Then we just have to know the characteristic and we may be able to even prescribe, right? If we come to the thing where the female now wants to work and says, I have to work, I have to support the family, and so more masculine features. And then you have this feeling of wooziness and feeling I don't belong, or feeling I've lost my clothes, or such feeling, it is in the upper rows. And then you get something like this congestion, the split, and the walking and the restlessness, and head heart migraine with some of the peculiar modalities. You can even choose the remedy and go for a better by lying on the abdomen, the other one better by holding the stomach. One more remedy by steam inhalation and the nose block is removed. So again, you in Kajuputnam, you had congestion making you restless and making you walk in a quiet, dignified manner alone. Whereas here you have lack of sleep due to congestion in the chest and the throat. Hot flushes and bleeding dissipate the congestion. So some way you have to get rid of the congestion. Kajuputnam, you're restless and you walk. And here you are bleeding or hot flushes, which reduces the congestion. So as in Kajuputnam, here also you see a struggle between the ever-present liquid feminine quality. Feminine spreads, okay, encompasses everyone. And the oppressing, obstructing male quality. So between suffocation in the male and the breathing freely in the female. So two opposing vectors that create congestion and difficulty in action. So they say either weakness or they say they can't work because there's too much overwhelming, they're confused, the head. Kajuputnam got up with like a debauchery night. And here you have the blocked nose. So you don't get enough air, so you can't breathe, so you don't have enough energy. Okay, so that is eucalyptus. We use eucalyptus a lot in just common usage. We use it for fever, for influenza, for malaria. You also use it as a preventive. And the whole thing is about nose block. So we put it in the hot steam bath and then the nose opens up. We feel better. And then the oppressive quality, obstructing of the male quality goes away and you have free. So like a hot pressing man, desire to move, this is the congestion. So here in eucalyptus, you're bleeding, hot flushes, or just the flowing which dissipates the congestion. So you have the spreading versus obstruction. Pain comes after a few hours because everything is slow. You have some urinary problems also, and mainly bronchial asthma with either exhilaration, which then goes on to depression, a hydrogenoid constitution, fetid bronchitis with weight loss and night sweat, lack of confidence in perform because they don't have the inner feminine guiding spirit and the mind of the masculine is not strong. So their lack of confidence, they can't perform. So you have exhilaration in the beginning and then all the buoyancy and all goes away. You have depression, exhaustion, dullness. So this is eucalyptus. So we've done Angophoria, Ophia, Kajuputnam, and eucalyptus. Now we do the next remedy, which is Eugenia jamboringa, which is Syzygium. And we all know Syzygium, but we use it only as a small remedy for diabetes. But even that is quite useful. So it's the Malabar plum. The family is the same, Myrtaceae, and the multiple stamens point to its primitive. Now, as you grow more mature, you have less. You have the split of the seed also, which become one, no split later. It's edible, vitamin C, fragrant fruit usually bears one seed split by a membrane. The remedy here also state of intoxication like in eucalyptus, as if they've had alcohol. So then with alcohol, they become talkative but lazy, and everything looks bigger and more beautiful. No, that is the beauty of alcohol. Everything looks nice, you feel happy, feel good. Even your house looks bigger and more beautiful. Your wife also looks beautiful. So you feel good. So you have alcohol every day. Yeah. But this excitement quickly deteriorates and you get depression, just like in eucalyptus. Constantly desirous of sitting alone, like in Kajupatnam, and reflecting, thinking, wants to be alone and hide, and doesn't want to do anything, again, like eucalyptus and Kaju. Nothing seems right and speaks rudely to people, like we saw in Kajupatnam once, to speak very rudely and behave rowdily. Congestion and rigidity again. Congestion. You see the headache, one side. Headache as if there's a board on the right side. Board on top of your head. Pressing it down. And it does not, even that rigid neck also doesn't allow you to turn your head. And with tearing hot congestive head in the morning. Nightly spasm in the soles of the feet. So congestion, spasm, split, rigidity, these are the words that get us to this subclass. Male, they have performance problems in male. So erections are very painful. I like the candle dropping. The erections fail or they're very painful. When the candle drops like that, light goes up, we are very pain. No? So erection drops. Premature ejaculation or lack of response to any touch or any picture, any movie, no response. Aggravation after intercourse because it was not very satisfying. Impotence. Emission of semen is too slow or entirely wanting during sex. In the skin, you have, this is not the penis, it's the finger. First, I thought it looked like a penis too. Skin, painful acne. The skin cracks easily in the fingers, cracks between the toes. And you have, pyronychia. It's a good remedy for pyronychia. Skin cracks easily in the fingers and between toes, pass around the fingernails. Soft and hard part, This is soft part, hard part. Soft part, hard part. Things which we never think of, now we are thinking, right? Soft, hard, male, female, masculine, feminine. Yeah. Congestion, free. Quite talkative but indolent. Prefers to do nothing. So they are still neither in feminine, masculine. They're not in the go-getter stage yet. Do nothing but smoke all day. Remarkable change mentally after urination. Feel very good. Release. Some more congestion gone. Sadness better after urination. But again, soon everything becomes gloomy again. Congestion in the chest. Feeling of pressure like a hot pressing belt. We saw it in the previous remedy, eucalyptus also. Hot pressing belt. Desire to move is there in all of them because it reduces the congestion. Desire to sit alone and reflect. Everything seems wrong, nothing seems right. Restlessness, constantly changing position. You can either walk or you just change or you shift from one place to another chair, to a bed, to the sofa, so on. Forgets all about his business. Very down. So still not go-getting. Here, the peculiar thing seems to be all things seem beautiful after urination. So that release, either you have the nasal drop release in eucalyptus or you have here the urination. So here, it's the same. Spreading watery feminine quality of column 4, battling the masculine, isolating, rigid, oppressive quality. No flow between the masculine and feminine leads to spasm. So you have the split, the spasm, the congestion, the restlessness, the discharge ameliorates, and so on. So clinically, you have acne rosacea like in rosacea, pimples, catarrhal fever, like in all the previous remedies, catars, comedons, again they are black acne-like things only. You take it out, you go to do a facial in the parlor, they'll take out all your comedons. Coryza, cough, sore throat, and cramp or spasm, constipation or diarrhea. We saw that in all the remedies, angophoria, in the kufia, the kaju putni, the eucalyptus, the diarrhea. So diarrhea should release, but here you have urine releasing. We've not seen anywhere where diarrhea release. We had the diarrhea, the dysentery and debility, yes, but we didn't see the release. Diplopia, hernia, hiccup in patients, influenza, nausea, otitis. So in the mouth, there is abundant accumulation, same like in Kaju Purnam, many eucalyptus, of frothy, viscid saliva, especially before meal or when talking. So talking becomes difficult, eating becomes difficult. Then you have the nightly cramps in the soles of the feet, like calcalia, curare, cuprum, max. Fissure between the toes. We saw the crack between fingers, toes. Skin recedes from the nails, forming pus. No pyronychia, maybe a good remedy for that. Cramp-like and paralytic pains in the tibia and the heel. Hot hands. In the rectum, you have cramp or pinching pains. Constipation. I don't know if you're holding it will be better, but anyway. Tenesmus, urging to stool and colic. Urging, but that is held, right? Loose evacuation, then followed by vomiting. Hemorrhoid, bleed copiously for days. And that any discharge is congestion, discharges ameliorate with great relief for both mind and body. So bleeding ameliorates, urine ameliorates, sneezing or coryza ameliorates. All discharges ameliorate. This is, so it's neither natural. Hemorrhoid bleed is not a natural kind of discharge, but it's still. Stool, there's scanty evacuation. The consistency is sandy, sputtering, fetid. So lot of smell. We started with sour smell in Kaju Putnam with milk and sour food aggravating. Here you are fetid. Very offensive. Even eucalyptus is very strong smelling. Very scanty, pasty, gritty stools. Scanty, hard stools. Alternate much pressure. Spasmodic closure of the anus. Or offensive spluttering stool without much urge. So lot of GI and stool complaint. So this was which remedy? Ezekiel, which is called Eugenia jambos. And what do we know about Ezekiel? We use it in diabetes. So cases of that make it clear, but most of it has been given mainly because of the diabetes, but still it helps to know the other part. So a man of 64, he was a famous cab, you know, this is a particular sect, hmm, Kabbalist who created a number of upheavals in the study of Kabbalistic literature. He worked day and night for years. And the totality by which he dedicated his life to the mind at the expense of the heart, and the totality of his self-sacrifice to his studies and his dedication brought on physical destruction at many levels. So, so much he just studied and studied day and night, all the literature, and he dedicated his life to it and didn't worry about anything, food or things. So this self-sacrifice, lot of physical problems. He had to have a bowel shortening operation. Then he suffered irregular heartbeat, as well as from diabetes that could not be balanced by the orthodox remedy. So he was given Zyzigium jamboliga with the intention of balancing the blood sugar. But as a result of that remedy, his blood sugar was to balance, but a systemic improvement happened. In this, level of energy occurred as well. His heartbeat became regular, digestive processes much improved. The remedy demonstrates typical column themes. Solitude, he studied alone, day and night, day and night, day and night. Religiousness, he was about religion, the Kabbalistic literature. Dedication, development mind up to the point where the body is annihilated. The mind keeps on working, body is annihilated. Regression to the pre-existing state of the first row. First row is connected with the other world. So other world, there's no body. It is mainly the mind. So here they're saying body is annihilated and is the pre-existing state of the first. The mind is overactivated, but without the heart warmth, the soul doesn't get to be wholly expressed. The sweetness of the heart is missing. Because the sweetness is missing, so the diabetic expression says Kobe Mehustan. He's given us a lot of cases. This Kobe Mehustan. So that was one case. Which was the case? It was just given on sugar to a Kabbalistic literature fellow who worked day and night, day and night, day and night to produce that literature, didn't bother about the heart or his body, and then finally had a bowel shortening, irregular heartbeats, and the diabetes. And then no medicine helped that diabetes, and he was given Zyzigium jambolenin, and which is a specific jamun. It is jamun in India. And it's known, jamun people have a lot of diabetes, people use a lot of jamun. And it helps. Or take out the jamun juice and have it. They don't know about homeopathy. I give Zyzigium in mother tincture, drops, 5 drops or 10 drops twice a day, and along with whatever they are doing, and it helps the sugar which was not coming down to come down. So here, it balanced the sugar, it improved his general health, his heartbeat became regular. So we are saying that it is lot, and then now you can see that there is the 5th column and the first row components. Yeah. So you have where the body is not there. He just avoided the body and forgot about it. He just work, mind, and body is overactivated without the heart warmth. Soul doesn't get to be expressed fully, and the sweetness of the heart is missing. So you get diabetes. Second case, woman 38 in the 7th month of pregnancy. She was suffering terribly from nausea and vomiting, severe edema, weakness, and allergies. All that we've seen, right? We've seen nausea, vomiting, we've seen allergies, and the edema, which is again congestion. So at some stage, mild gestational diabetes developed. There was no additional information. So in the case, so given Zyzigium 6C once a day on the basis of sugar affiliation. Sorry, I did this last minute. I found the cases, so I did it. So the typing is pretty bad. The results were not only to balance the sugar, but the total healing of the severe manifestation of the pregnancy and the allergies, and I was quite surprised, says Cook. Again, the difficult pregnancy is related to the weakened feminine quality. There's Zyzigium jambolinum used in mother tincture form or in low potencies for diabetes, along with any remedies, and you will find a result. We start with that and see if you have mind body split, you have masculine feminine split, you have the body not being served by the mind, which is working. We get a result. So I think this is our last remedy, the Arjuna, Terminalia Arjuna. So it is in short not called Arjuna, it's called term. So it belongs to the family Combretaceae. The edible fruits of the tree are rich in oil, again oil, thus its ability to float. The plant can float from island to island. And just like Arnica is used to treat, it's not line, it's like Arnica used to treat bruises, cracked skin and broken bones. Arjuna is also used. And in Ayurveda, it is known to have beneficial effect in coronary artery disease. So Arjuna is seen in the whole Indian subcontinent and found growing in the riverbanks or dry riverbeds in Uttar Pradesh, Bihar, Madhya Pradesh, West Bengal, Odisha, South and Central Asia. Also in Sri Lanka and Bangladesh, it has been planted, and it also, like the eucalyptus, grows very fast. So the studies which were done, research studies, 10 patients with hypertension and congestive heart failure received 4 grams of Arjuna bark powder twice a day for 1 month. The researchers saw improvement in the functional class, breathlessness, and overall well-being, with significant diuresis and a fall in both systolic and diastolic pressure. There were many of these small snippets which I thought I should give you. So in homeopathy, it is cheerful and happy despite pain. Which other remedy we saw right long ago?
Agrimony.
Very good, Vibha. So cheerful and happy despite pains. Afterward become irritable and grumpy, worries a lot, and attacks of anxiety accompanied by heart palpitation. Again, averse to company, which one we saw? Kaju Putnam walks alone, dignifiedly walks. But mind is all hazy, like we saw in eucalyptus, and also in Kaju Putnam, feels as if it is debauched, can't work, can't find the clothes, does not want to work, and very lazy. But here, dreams of seaside and homesick. This is not seen before in any of the remedies. And dreams of snakes. We saw cats and fire in that remedy, Daphne. Cats and fire. So headache with dizziness and heaviness. Swollen, flabby, soft tongue. Saw this in 2-3 remedies. Dryness in the mouth and ringing in the ears. Even the lower part of the body, because it's connected to the other world, is affected here. Diarrhea. Diarrhea with flatulence, again congestion, right? So to reduce it, you walk or you bleed, or you have diarrhea, or you have nose running. Rhinitis with flatulence, which relieves, or you have urine, as we saw in the previous. Abdominal pain on the right side is better by rubbing. Loses sensation in the lower part of the body, mainly left side. There are some which are right and left. I don't know if there's very much significance. Here you have fear of sex. Affinity for heart. So used in Ayurveda for heart and lung afflictions. In addition, there may be many skin problems that strangely enough are ameliorated by scratching. So this is Terminalia Arjuna, where you have itching, better by scratching. Most of the remedies we know is worse by scratching and bleeds, and is better by cold or hot. Here you have better by scratching. So it is good for heart health, reduce cholesterol, blood pressure, antioxidant. So we saw two nice things, na? Diarrhea in that angophoria, diarrhea, dysentery and debility. Here you have heart, cholesterol, blood pressure. So if it can help reduce cholesterol, we can even give it in a lower potency along with the other. So keynotes, lot of arnica-like injuries and the heart circulation. It supersedes the arnica in cases of injury, any injury, bone injury or deep tissue injury. You have also Bellis pair, right? So arnica, Bellis pair, and now we learn terminalia Arjuna. If the pain is remaining after injury, give this remedy. It will quicker than arnica in high potency. This remedy is known for being a cardiac tonic, Arjuna. It's called term. And in difficult cases with cardiac pathology and palpitation and dropsy, think of this remedy. So if cratagus, which we use, remember we did cratagus right in the beginning, or convallaria majus does not help, think of terminalia Arjuna. The Ayurvedic physicians who are called Kavirajas in our country, using this drug independently or with one of the other ingredients in all heart disease, with marked success for a long time. We use it in both functional and organic diseases of the heart, like angina. Palpitations, pain in the heart, weakness, and fractures, pains all over the body due to a fall, or all sorts of ichymos. Terminalia Arjuna. So thank you so much. Lots of not plants, lots the leaves and the plants with you all. I think today was good. We repeated so much that if you go away, you will find that you today remember. If you do it today only, just revise whatever you have, notes you have kept or whatever you have done. You'll be quickly able to today think of it. And maybe today we have no time. We've already reached 5 o'clock. So we'll do the one-liners till whatever we've done till now next time. Okay? And we asked a lot of people for cases, but I myself have only cases of Zizigium, which I give along with the other remedy. And definitely I use a lot of Zizigium mother tincture. And so also a lot of other Calcutta people said they use that, and they use Arjuna for just benefiting after a long illness. But nobody even told me that they use it for injury after a long time. So we should try that. Okay. Thank you so much. Any questions? Preeti, open up to all of them. Can I see them?
I don't have questions, but I just want to put it like last time I told Dr. Rama that mesothelioma we know only that skin problem, what we face to patients cure. Now the same thing I like to tell you, we know cesium for diabetes, we know other medicine which you put it is for that only. But now looking at details, what you told is really difficult for us to digest, but we need repetition. So we have to do our own. But thank you so much for making such a good efforts to make us understand in details.
And to repeat 3-4 times so that you remember. I think that was a good innovation I did today. I thought even if I have to repeat so many times, other people also. So if we repeat and we compare. Yes. Natramur we saw, in one remedy, we saw Natramur gives up. But which is the remedy we said? Which does not give up. It was a remedy we did last time, Mesarium, which does not give up. It has failure of love, but it does not give up like this thing. Yes, anything else? So repetition is nice. One-liners are nice. Revising on the same day will be really nice. And today's remedy was short. So we can easily, do them and use them. Okay?
Thank you.
Thank you so much. Thank you, everybody. Anything anybody else wants to share? Dr. Rama, Dr. Samita, Dr. Praveen?
Yes, I learned a lot. I have used among 4 remedies what you have spoken.
Six.
Kaju Patam and Cesium.
Yeah. So Kaju Putnam,
Other
tell us
medicines I
your,
have no, terminalia also, of course.
okay, so tell us how you use it, please. It'll be helpful.
Actually, Cesium I use if somebody has got glycosuria.
Yeah.
If sugar is not there in urine, Cesium is not indicated.
Okay. That's
It
a
is
good
not
thing.
for hyperglycemia alone. Hyperglycemia, according to me, that Zimnema, Broma, Cifalandra, all these drugs are acid fast, all these drugs are very useful. But if there is glycosuria, which is very prominent and making him weak,
Yeah.
then
Because
I
urine is
would
a,
prefer
yeah.
giving Cesium.
Hmm.
So that is what. Then Terminalia Arjuna for heart or heart problem, IHD with HTN, invariably I prescribe Terminalia, mother teacher.
How much? How many drops and
10 drops 3 times a day,
in
but
half?
along with some regular constitutional remedy,
Yes.
not just alone
Yes.
Terminalia.
Yes. And Kaju Putnam?
Kajuputam once or twice I have used. Other drugs I never heard the name all.
Yes, yes. But today it became a little bit clearer. We can use them, huh? And Angophora is such a small remedy.
Of
with
course,
lot-
of course, of course, of course.
Yeah.
That's what, like you said, Angophora for constipation. I've been using quite a lot of remedies for many people who have got obstipation, leave
Yes,
alone constipation.
yes.
So I'll use this also, and let me see. Will
And let's
it
see
work?
flatulence with lot of flatulence and lot of pain
Yeah,
going down, better
yeah.
by lying on the abdomen.
Right.
And
True.
Kufia was also a nice remedy. And then we
Yeah.
had the swollen tongue, which was good. Last
Correct.
time we did the hydrangea with the yellow sand and the white amorphous, which I asked all patients, but nobody I found in this week. Yeah. Anything else?
Enough. Thank you. Learned
Thank
a
you
lot.
so much. Thank you.
Thank you.
Finished bang on 5 o'clock.
Bye. Thank you.
Thank you. Thank you. Bye-bye.
Bye.
Next time, we are doing a few more remedies of this. And then we do a very nice group called Fables. Okay. Okay. Bye. Tabussam, anything to say? No? Rashmi? Okay then. Bye. Thank you, Mom.